By 2050, the world's population is expected to be 9 billion people, and most of these people will be living in large cities. Experts estimate that the demand for food will increase by nearly 100%, yet there will be fewer agricultural workers and a decrease in arable land. These predictions highlight the challenges in producing and distributing safe food throughout the world. They also raise questions about how we maintain our environment while trying to feed a rapidly increasing population. We'll be talking about these challenges on today's episode of A Public Health Journal. Please stay tuned.
Welcome to A Public Health Journal, a program that explores public health issues facing our society today and tomorrow. The host of the show is Dr. Ed Ellinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health and the Hennepin County Human Services and Public Health Department, all working together towards the goal of healthy people living in healthy communities.
Welcome to A Public Health Journal. With a rapidly growing population and increased demand for animal protein and climate changes that are affecting the amount of arable land, world food supplies are becoming increasingly vulnerable. Unless we plan carefully and change our approach to food security, the possibility exists that we will not have enough food to meet the dietary needs of a large percentage of the world's population. This has major implications for the health of the world's population, but also for the political and economic stability of societies around the globe. Joining me today is Dr. Will Hueston, a veterinarian epidemiologist who has worked with government, industry, and academic organizations on issues of food supply, human health, animal health, and the environment. Will, welcome to our program.
Happy to be here.
You're the first veterinarian on the show, and why should I have a veterinarian on the show talking about public health?
Well, thanks for the honor. You know, every veterinarian in the United States takes an oath to protect animal health and to promote public health. So every veterinarian in the United States is a public health official in the sense that that's part of the professional oath that they take.
All right. So how does a veterinarian influence public health?
Well, remember that a lot of the diseases that we study, as an example, also are diseases of humans. So you think of rabies, or you think of a lot of the issues that cause foodborne illness, or you think of influenza. All animals and humans share many of these infectious diseases. So there's one example of the connection. Mm-hmm. A second would be, I like to say that everything we do in veterinary medicine involves public health. It's either providing for an abundant, affordable, and safe food supply for the nation, preventing, controlling, and responding to outbreaks of diseases shared by animals and man, or promoting the psychological well-being of the nation through the care of companion animals, that human-animal bond. And lastly, not to be forgotten, is the role that veterinary medicine plays in advancing medical knowledge for everyone, whether it's surgical techniques or the development of new therapies and drugs or vaccines and strategies to prevent disease.
That's right, a lot of animal testing for different drugs and vaccines.
Exactly.
Now, you also are the director or executive director of the Global Initiative for Food Systems Leadership. Tell me a little bit about that, food systems and the leadership that's required for that.
Well, increasingly we benefit, especially in the United States and in Europe, we benefit from a food supply that is sourced around the world. And that system that delivers to us our coffee in the morning, or the bananas, or that we enjoy, or all of the variety of foods that we have on every day, means that on a daily basis we're consuming foods from 20 to 30 different nations. So the opportunity is, how can we work together across boundaries, across disciplines, across sectors, public sector, private sector, to ensure that we have an abundant, affordable, and safe food supply for everyone in the world.
Okay. Now, we're going to be talking about food supply,
Sure.
Food security, and I've got a slide here that shows what people eat, where they get their
Right.
calories throughout the world. And we'll put the slide up, and we'll use it as a way of saying, look at, we've got, half of the people, it comes from cereals, and next is roots and tubers, about 5.3%, meat and fish, kind of the protein things, about 13%. What does this slide tell us in terms of looking at food supply, some of the issues that we have to be aware of with a food distribution like this?
Well, the first thing that tells us is that the food supply is very diverse. Everyone in the world eats, and people in the world eat everything that they can possibly eat, so there's a huge variety. But for many parts of the world, they depend on some very basic grains for their diet. As their income, as their economic well-being increases, they search for more and more protein options. And that's where the meat and protein. So you talked as you began the show about the rise in the demand for food, and we anticipate the rise in the demand for animal proteins to be even faster than the need for the total volume of food, because we have China, Africa, Southeast Asia, as their economic status increases, they want to be able to enjoy meat, poultry, fish, eggs, milk in the same way that we enjoy on a daily basis and don't even think about.
And is it more resource intense to create those proteins, the animal sources of calories?
Well, it's a more complex system. Remember, in some areas of the world, they have abundant grass. Well, humans can't eat grass. They can eat it, but they can't digest it and meet their energy and protein needs. But ruminants can. So in some parts of the world, the animals play a role in converting non-human type of foods to something that's edible for humans. The other is that animal protein provides a very high quality protein and meets a number of the needs that humans have for growth and development. So I think it would be safe to say that the complexity of the food supply will continue to increase, because each part of the world has, if you will, a distinct advantage in producing some type of food.
And I've got another slide here that looks at sort of the people who are undernourished throughout the world and what's been happening over the course of the last several years. I want to take a little look at the challenges, the people who are undernourished, and seeing what's going on here. We, since for the last several years, it was stable, and then it dropped down in 1995 to 97, and now is really going up. It seems to be an increasing number of people who are undernourished in our world.
Indeed. And part of that reflects the growth in population. A large part of it reflects the variability in prices of food. So we have a significant number of people in the world that live with incomes less than $1 a day. And so a very small increase in the price of food can have a dramatic impact on their ability to feed themselves. We also have weather issues. So the drought in southern Somalia, the people have been hanging on through this drought as far as they can, and finally, to protect their family, and they're fleeing from that drought area to another area. And so it's very hard to establish, if you will, a food system that is resilient enough and flexible enough to meet all of those needs.
So does the kind of economic, or the economic climate, the political climate,
Absolutely.
and the physical climate, it seems to
Absolutely.
all affect food supply?
It all affects it. It all affects. So with climate change and climate variability, with changes in regimes, with wars and civil strife, with political posturing, all of those contribute. For instance, if prices go up, let's say the price of rice, which is a tremendous commodity in some parts of the world. Some countries have said, okay, we're going to stop exporting rice. We're going to keep that rice for our own people. Well, that distorted the whole system, where other countries were dependent on the trade in rice. And so it creates a very complex series of consequences, many unintended, but they have negative public health outcomes.
And you talked earlier about the fact that we have a global sort of marketplace for food. And yet on that first slide that I showed, about 51% of the calories come from grains. And I understand that about 60% of all of that comes from three things, rice and corn and wheat. Does that raise some risks if that we're so dependent on three crops throughout the world?
Well, yes and no. One thing is, remember that whether you're talking about corn or wheat or rice, there are a lot of different types. At the same time, if we have a new disease that develops that affects wheat, then we've got to be concerned about the impact that can have in distorting the world food supply and these prices that we talked about, the unavailability of food. What it comes down to, Ed, is this is why we talk about food systems leadership. It means that we need to have leadership, a shared leadership that crosses disciplines, physicians, veterinarians, that crosses sectors, public sector, private sector, crosses geographic boundaries between the developing countries and developed, to develop this more robust and resilient and flexible food supply to meet the needs of everyone.
Good. Well, I want to talk about some of the particular risks. We've identified a couple of them. I want to go a little bit more, but first we need to take a little break.
Great.
So we'll be back right after this message.
kitchen surfaces, utensils, and hands with soapy water. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
Welcome back. We're talking about food distribution, food safety with Will Hueston, a professor in the College of Veterinary Medicine and an adjunct professor in the School of Public Health at the University of Minnesota. It's really nice to have you in both of those colleges and schools at the university. And we're talking about food security, and that may be a term that people don't understand. How do you define food security?
Well, food security involves the availability and access to safe, affordable, nutritious food that allows individuals to express the full opportunity of life. And it says it's available to everyone in the world at all times.
Yeah, and this is not just an issue in developing countries, from what I understand, because I know even in Minneapolis, St. Paul, we have areas where there are sort of food deserts and food insecurity because of economic issues.
Absolutely. So that's the access part of it. Mm-hmm. We also have situations in which people cannot fulfill their nutritional needs. They may have availability of certain types of foods, but not all the variety of foods to meet their needs for energy, for protein, and for some of the micronutrients and vitamins that we need.
Right. Now, I've got a slide that kind of lists some of the issues related to food insecurity, and we've talked about some of these already, but I want to make sure that we sort of hit the things that you think are the biggest threats to our food supply or our food accessibility. Certainly we talked about population increases, the growth in cities. How does that reflect the food insecurity?
Well, we've seen, let's take the situation in Minnesota. So among the listeners to this show, there'll be many people who can go back 1 or 2 generations to the farm. If we go back 100 years ago, most of the people in Minnesota lived out in the countryside. They had farms, they produced a portion of their food. Much of that food was traded locally. Well, with the growth and changes in the development of America and development of industry and trade and the economic status, people moved to the big cities. And the larger the city, the greater the food demand in a very small area. So that you can no longer meet those food needs within a very close distance. We couldn't feed the people of the Twin Cities within 10 miles, within the distance that you used to be able to drive with a horse and buggy. So the challenge is that around the world, with this huge population increase, we have a rapid expansion of megacities. Go on the web sometime and Google the number of cities in Asia now that have more than 1 million people. It's absolutely mind-boggling. So we have people moving to the cities, we have displacement of people, they're coming from the rural areas to the cities. It creates increased demand for the movement of foodstuffs, for the storage of food.
Mm-hmm. And then there are fewer agricultural workers, but we're getting much more productive in the workers that we have?
We're getting more productive, indeed, and we're developing new strategies for preserving and treating food. The trouble is that isn't available everywhere in the world. Mm-hmm. So I had a very poignant moment earlier this year with a colleague from Africa. And he pointed out, he said, you know, in our country, he said there are farmers 10 miles from where I am now that can grow more food than what they need, but that food spoils because they have no mechanism to get them to the cities where the people need to have food to eat. So we need to, that's the whole driver for coming up with more flexible
So it's not just
programs.
production.
It's not just production, exactly.
But it's also transportation and ability to purchase and those
Exactly.
things.
Well, we have people, as you know, your and my parents probably said, when you have a plate of food, they said, finish everything, because remember the starving children and pick your country. And today in the United States, we have amazing amount of food. And we, in fact, waste a great deal of food, where in other parts of the world, the amount of food that we waste would meet the nutritional needs of a number of people. Now, that's not easily addressed. So again, it takes a very dynamic type of shared leadership to look how we're going to develop the system to pull that all together.
Yeah. Now, I didn't research this, and you may know the exact number, but I understand that our food system throughout the world creates about 2,700 calories per individual per day. That's what we produce. And people need about 2,500 or less. Right. So we're actually producing enough calories for folks, but we just can't distribute it as well?
Can't distribute it, can't store it, and we have loss at different places. You know, you grow the food in the field or raise the animal, and then as that animal or grain moves through the food system, there is loss of some of that along the way. I'll give you an example. when our grandparents were around, if they butchered a chicken for Sunday dinner, they ate just about everything of the chicken that was possible to eat. But the average American no longer likes dark meat, and they certainly don't want to eat the organ meats, and nobody wants to eat the neck. And so we end up now, a part of that animal protein that we've just raised no longer fits with our interests, our food preferences. So you know, the poultry industry in the United States, the fact that we can go in and get breast meat of chicken at such a reasonable price depends in part on our ability to export the dark meat and then to export parts like chicken feet to Southeast Asia. Our ability to export chicken feet to meet nutritional needs of Southeast Asia helps us have an affordable food supply and be able to buy the breast meat.
Interesting.
Yeah.
Now, one of the risks that was identified was the increased demand for animal protein. How is that a risk, a food risk?
Well, what happens is as there's a demand for animal protein, then there is a redirection of some of the resources to raising animals to meet that demand. So the very issue we were talking about, the United States, as countries get more affluent, then they pull more and more of the food to that country to meet the needs and to provide the choice around the year.
Well, one of the issues that wasn't on that list is using grains and plants for energy, corn for ethanol.
Right.
Is that a risk for our food supply?
Well, everything that we do in terms of agriculture and the food supply has implications. The challenge is how do we balance those implications? So we know that we can take the residue, if you will, from some of that energy production, those grains after you've made the ethanol, and that can be a foodstuff for animals. So it's not the complete loss that some people think about. At the same time, we need to look at how all those bits fit together. How do we meet our energy needs while meeting our food needs? That's an ongoing discussion, an ongoing balance.
Mm-hmm. All right, we've talked a lot about the problems, and
Right.
I want to talk about some of the solutions. And I know you've been talking about this whole issue of One Health, and I want to get to that in the last segment of our program, but we need to take a little break before we get to that.
Wonderful.
We'll be back right after this message.
Separate raw meats from other foods by using different cutting boards. 3,000 Americans will die from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
Welcome back. We're talking about food security, food distribution systems, nutrition throughout the world with Will Hueston, professor in the College of Veterinary Medicine in the School of Public Health at the University of Minnesota. Well, let's use this last segment to talk about solutions. We've talked about the problems, and there are multiple problems, but and I hope there are some solutions. And one of the things that I noticed that you talk about is One Health. What are you talking about when you talk about One Health?
One Health says that we need to broaden our lens. While our training is pretty narrow, you were trained to look at human health. I was trained largely to look at animal health. We have others that are trained to look at plant health. We have people who are trained to look at the economic health or the societal health of countries. Well, all of those are interrelated. As you mentioned earlier, our ability to have a safe, affordable, accessible food supply depends on the societal stability of our country and the economic stability. So we need to look across all of these components of health that are interdependent at the same time. So that's the One Health. It's a single vision that takes into consideration the health of people, the health of animals and plants and the environment, as well as the health of the economy and the health of the society.
It strikes me that we've been talking in state government about the fact that there's health in all policies.
Exactly.
Transportation policies, housing policies, economic policies, tax policies.
Perfect example.
All impact health.
Exactly.
But I've been thinking of it more just in terms of health impact on individuals. I suspect there's food security health, there's veterinary medicine, kind of animal health in all policies also, I suspect.
Indeed. And you know, let me give some examples that I want to congratulate the Department of Health on. In Minnesota, we really have a unique situation in which a number of the departments have very comfortable working relationships. So some of the issues we work with pulled together the Department of Health, the Department of Natural Resources, the Board of Animal Health, the Department of Agriculture, all sitting down and working together and saying, we recognize we all have a part of this issue and we must coordinate and work together to make the greatest positive impact on the lives of Minnesotans and people everywhere. That is a One Health approach.
All right. So how are you trying to get at that One Health approach? Are you doing that through your global initiative on food system leadership? Is that sort of the approach you're taking with that?
Yes, we're doing it in the training we do at the University of Minnesota. We're doing it in the work we do with organizations and with individuals around the world. So it says that as you're training the next physician or the next veterinarian, that we expose them during their training to other professionals. So they develop a comfort level and an understanding of what each profession brings to the table, an ability to sit down and say, you know, how can we work together? How can we leverage our individual strengths to make progress? A lot of what I do is helping to build public-private partnerships. Government alone cannot address all of this food system, this food safety, global food security problem. It has to be government and the private sector and the individuals, the society itself. So we must do that together. And yet, largely, if we bring together these different sectors, public and private sector, it takes a while to learn the language of each other, to develop that relationship. So a lot of what we do is help develop relationships between countries, between sectors, between professions, so that we can work more effectively to make incremental positive progress.
So what kind of professionals are you working with here at the University of Minnesota in particular to work cross-collaboratively, cross-disciplinary?
Right, so we have the folks that work in the College of Agriculture, you know, food, agriculture, and natural resource sciences, folks that work in the College of Biological Sciences, so they may be a virologist or a microbiologist or an ecologist. I'll give you another interesting one, people in design. So the folks in design, rural design, have a fascinating way and said, we need to look at how we design the world we live in so that we can support the public health goals that we all share. We work with the Department, the School of Public Health, we work with the college, the School of Medicine, so it's a wide range of schools.
So then, and then the other one that comes, oftentimes we hear about, you know, big industry, you know, agribusiness, right, with, you know, profit motive and monoculture. And how do you get them to work with the government, with the not-for-profits, and internationally to say we need to really do this more collaboratively as opposed to our little cylinders, right, of excellence, as I call them?
Well, first and foremost, we developed the shared interest. You know, I don't know of a single large food company whose goal it is to make people sick. I don't know a single large food company whose goal it is to actually alienate the very people who are the consumers of their products. So these large companies share the goals that we have in public health and whether it's at the university or in the Department of Health. They would like to see an affordable, accessible, nutritious food supply for everyone in the world, because everyone in the world are their workers, their consumers, they depend on it. So the stability of the company, the lifeblood, if you will, of a food company is to have healthy consumers and healthy workers. So it's all interconnected. So we focus on the areas in which we can agree, and then we find opportunities which we can make incremental progress on the areas in which we agree. And part of that says, instead of waiting till there's a problem and reacting to the problem, let's sit down and anticipate the implications of some of the changes that we've talked about and see how we can steer, guide the future so that we can avoid some of these calamities, these challenges, these outbreaks.
One of the other areas that is public policy, and I know, right, the Farm Bill is coming, right, up, and this every 5 years, this Farm Bill. That's a huge public health bill.
Yes.
Called the Farm Bill, but it has a lot of public health implications. How are you getting involved, or how do people get involved in making that Farm Bill one of these One Health kinds of bills?
Well, we're actively developing, and this is in conjunction with the Center for Integrative Leadership. Now, here's two more schools at the University of Minnesota, the Humphrey School of Public Affairs and the Carlson School of Business. we developed a program called Finding Common Ground, where we bring a broad cross-section of citizens together and discuss some of these complex issues. And how do we balance the paradox of some of these complex issues, whether it's antibiotics in agriculture or whether it's the way we respond to emerging diseases of animals or plants or humans. And so in developing that policy, the most powerful opportunity we have of developing better policy is to broaden the level of engagement. So we get more perspectives represented so we can better understand not only the intended but the unintended consequences of what we do through public policy.
All right. Well, this has been a great conversation. We've covered lots of ground, many more items that we need to cover, but we're running out of time. So thanks for being with us, Will. I really appreciate it.
I thoroughly enjoyed it. Thanks so much,
Good.
Ed.
We'll have you back again, I'm sure.
Great. I'll look forward to it.
Good. And I'll be back with a closing comment right after this message.
Cook foods to the right temperature using a food thermometer. 3,000 Americans will die from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
Today's discussion highlights the fact that we need new solutions to the current and future food security problems. Simply doing more of what we are doing today will not get us to where we need to be, and may even be destructive to our health and the health of our environment. And no single solution will be sufficient. Wendell Berry, a poet and farmer, stated this well. He said, quote, "A bad solution is bad because it acts destructively upon the larger patterns in which it is contained. A bad solution solves for a single purpose or goal, such as increased production. And it is typical of such solutions that they achieve stupendous increase in production at exorbitant biological and social costs. Good solutions recognize that they are part of a larger whole. They solve more than one problem and don't create new problems," end quote. And one of my favorite public health heroes, Norman Borlaug, who was responsible for the Green Revolution, which dramatically increased production, echoed that perspective when he said, quote, "For more than half a century, I have worked with the production of more and better wheat for feeding the hungry people. But wheat is merely a catalyst, a part of the picture. I am interested in the total development of human beings. Only by attacking the whole problem can we raise the standard of living for all people in all communities so that they will be able to live decent lives. This is something that we want for all people on this planet," end quote. As these two gentlemen suggest, to enhance food security, we need good solutions that affect a broader goal. We need to get out of our silos or our cylinders of excellence and work with people in other sectors and other disciplines and other institutions who have differing perspectives on what needs to be done. Only then will we come up with good solutions that benefit all humans, all animals, all plants, and the environment. That will be a good solution. That's all for today. Thanks for watching. I hope you can join us next time on A Public Health Journal.